Well, we know that we are trying to get a hold on this COVID-19, and it's through, of course, vaccinations. And there's a new program that Dr. Ian Smith is a part of. It's called FlexforChecks, and with me this morning is the man himself, Dr. Ian Smith. How are you, Dr. Smith?
Hey, Brad, I'm great. Thanks for having me on the show again.
So, it's always a pleasure because I like how you explain things in layman terms for us to understand what is going on out there in the medical world. And right now, we're moving into, as you could say, into our fall season, into our winter season, but we still got to get a grasp on COVID-19, the flus, everything like that. So you're in this new program that is addressing to our minority community called FlexforChecks. Tell me more about this.
Sure. Well, first let me say that you're correct. I mean, we're heading into the fall/winter season. It's extremely important. It's going to determine kind of where we head with regards to the pandemic. So far, it's not a good sign of what's happening. The Delta variant is extremely contagious. It's extremely deadly. It's transmitting very rapidly. That's a problem. The second problem is that still about 70 million Americans who are available to get vaccinated have not been vaccinated yet. And what we're seeing very clearly across the country is that those people who are getting most infected, those who are dying more, are those who are unvaccinated. When you look at those states that have the lowest vaccination rates and you look at their death rates, you look at the infection rates, it's about people who are unvaccinated. And by the way, this is not a surprise to the scientists and to the doctors. A lot of us have been saying this since the beginning of the pandemic, that we need to work on this all together. And so those, unfortunately, who are unvaccinated are transmitting the virus. And by the way, those who are vaccinated now are becoming vulnerable to infections. They're not dying from the Delta variant, but they are vulnerable to what's called a breakthrough infection. So the bottom line is we need to still wear masks, we need to still socially distance, and we need to get vaccinated. The program I'm working with is called FlexforChecks. FLEX for checks. And the idea is very simple. HRSA, the administration, the government administration organization, Health Resources and Service Administration, has given an $11 million grant to the National Minority Health Association to try to get as many people vaccinated as possible. And by the way, the program's open to everyone. The target is the medically underserved, but anyone can go to the website FlexforChecks.com/Dr. Ian Smith and sign up. And as a bonus, it's not a reason to get the vaccination, but everyone who gets vaccinated gets $50. And the idea is not trying to buy people's vaccination, but the idea is to try to encourage people and their loved ones to get vaccinated and explain to them how important it is, which is why they're also giving them $50.
Yeah, and I got to mention that $50 actually will help them get families there, because as we know, some of the minority community doesn't have the transportation like some people think. They might have to call a car service. They might need to do different transportations from different buses or taxis or whatever, and that's more what they're saying this money is going to help you get to those locations. Am I right?
Absolutely. We don't want people to think that we're just trying to buy your vaccination. That is not the case, and we don't want people to spin it that way. The idea is that sometimes going to get vaccinated is not convenient, and sometimes it costs something. And for some people who may be financially strapped, the cost to go get the vaccine may be a deterrent. So $50 to everyone. And I have to reiterate, it's open to anyone who wants to get vaccinated. By all means, we want everyone to join the program. It's very interesting. We're at a very critical time in the country, Brad, because so many hospitals around the country, particularly those in those states that have high rates of unvaccination, so many hospitals are at capacity. And now what health administrators and hospital administrators are trying to figure out is, are they going to start rationing care? We don't know if this is going to happen, but there are real conversations about if someone is unvaccinated and they become infected and get sick and need hospitalization, do you give them priority over someone who has breast cancer or heart disease or diabetes who needs to be hospitalized? We're getting to a point now where, because we're at such capacity, that doctors and healthcare administrators or hospitalists are trying to figure out, is that where we're going to go? Those are questions that no hospital administrator or doctor wants to have to answer, which is why we're trying to explain to people, please get vaccinated.
Yeah, and our minority community is really where, as you said, we're seeing some of the problems of getting there and getting it done, or even trying to break some of the myths to them, which is very important. And that's why this whole program is so great for everybody to go check out and get educated.
Yeah, there's been so much misinformation about the vaccines, information coming from people who are not scientists, who are not doctors, who probably didn't even have high school biology, who all of a sudden on social media have become experts on virus. Well, virology is not politics. Virology is not um, um, uh, uh, religion. Virology is science, and you want to listen to scientists. You don't want me advising the country on how to come out of an economic problem, meltdown. I'm not an economist. I don't listen to me. I mean, that's not what I do. And so I encourage people out there who are on the fence or who decided not to do it because they've heard someone say something, a celebrity or someone who doesn't really know science. Please listen to your doctors, listen to the public health advocates. Over 600,000 of our fellow Americans are dying. We have now kids who are dying, who are in the ICUs. Please, this is not a game. This is not politics or religion-based. This is science. We have to be vaccinated to save all of us.
Yeah. Let me talk a little about vaccinations with you, doctor, because, they were talking about that we would need a booster, but you in the medical industry are saying, no, get the first one, get the first two, and that's going to help us actually start to curve this before we actually even think about the booster, because, again, the booster could, not work because no one is vaccinated like they should be.
Well, people should understand what a booster is. A booster is something that gives you a jump. And so you don't need a booster before you actually get the real thing, the real vaccination. So the idea is when you get vaccinated, that primes your immune system to create the antibodies or the body's immune soldiers that are going to help you fight the infection. So you first get your vaccination. Moderna and Pfizer is 2-shot, Johnson & Johnson is 1-shot. Once you get that, then you're considered to be vaccinated. Now, what they've seen, Brad, is that after about 6 or 8 months, depending on the vaccine, that the amount of antibodies that you've developed by being vaccinated starts to diminish inside the body. Well, when your soldiers start to diminish, you can imagine that you end up not being so good at fighting the war. And that's what the booster does. The booster is another shot after you've had the first couple of shots and after some time has elapsed to allow you to kind of reprime and get more soldiers into the fight. That's what a booster is. And so people who are not vaccinated, worry about getting the first vaccine and getting it complete, and then down the road, needing a booster shot.
Yeah, and let's make sure people understand, it's just like every year you get a flu shot, so it's going to be that way. It's just, again, get the first two, and then we'll move on to the next one, just like the flu shot does, right?
Yeah, I would just encourage people, please. I mean, this is a life or death kind of situation. And we hope one day that we have medications that can help the situation. We don't have them yet in wide supply that can actually, prevent death or cure. We do have monoclonal antibodies that are not widely available. So right now we have the vaccine. And just like we get other vaccines every year, we may, I don't know for sure, but it looks like we may need to get a vaccine for COVID every year, unless things change. If everyone gets vaccinated quickly and we practice social distancing and wearing masks and we get the virus load in the country down, we actually may get through this. We all want to get through this. None of us want to take more shots than necessary. We're on the same team with that, but we got to do it together.
There you go. Doctor, I'm so glad you joined me today to talk about this. It's so important. It is the FlexforChecks program, and tell them where they can find out more information.
Sure. If they go to FlexforChecks / Dr. Ian Smith, put that in, they can see a place to register. And like I said before, get $50. Also on my Instagram page, I post about it. So go to at Dr. Ian Smith, spell the doctor out, IAN Smith on Instagram.
Perfect. And doctor, hopefully I check back in with you since we are going into the flu season, and you have some great remedies. You have some great ways to stay healthy. So hopefully I check back in with you later on in the month as we talk about that.
We're looking forward to it, Brian.
All right. Thank you, doctor.
All right. Take care.